Hi there. I'm Randy Patterson, and this is Psychology Salon, a channel about psychological issues. If you like this kind of thing, click subscribe. This post is about trauma, which is something on many minds these days. This isn't the first go round. Trauma reappears as a subject of intense focus in the mental health field about every 15 years. And of course, it never entirely goes away. We're at the peak of one of those waves right now. And it's worth talking about because the mental health field doesn't have the greatest history with trauma. Freud, for example, famously seems to have underplayed the role of traumatic sexual experiences in the lives of his patients. Much of the trouble in the past 40 years has involved a surge of interest in specific types of trauma or specific treatment strategies, and these have often led to problems in practice. In the late 1980s and early 90s, for example, there was a period of great concern about satanic ritual abuse. People everywhere were getting diagnosed as being the victims of huge satanic cults that turned out in virtually every example not to have existed. It really was, for the most part, a form of mass delusion that affected not only the general public, but also the mental health field itself. And it caused an unbelievable amount of harm. There are other examples, including an attempt to prevent post-traumatic stress disorder from developing, great goal, that sounded good, but it turned out to produce more and stronger post-traumatic reactions than doing nothing. So it's always a good idea to look closely when we get enthusiastic about an area where we have not done well in the past. And this is not to say that we have always made things worse. There are empirically demonstrated treatments for trauma, including practices like prolonged exposure, that can be very helpful. We carry out some of these treatments in my own clinic. But that's not my subject today. The mental health field has a troubling tendency that we can see repeated over and over again. We develop a new treatment or a strategy for a specific problem, and it seems to work. Eventually, good outcome studies are done, and it turns out that, yes, this is a good addition to the range of things that can be used. But then, having turned out to be helpful for one problem, we begin applying it to others. And sooner or later, people are using it for practically everything, even though the research only supports it for that initial problem. So there's this problem of border creep that happens with interventions. You're probably familiar with the idea that if you invent a hammer, suddenly everything looks like it needs to be hammered. Border creep also happens with diagnoses. So a problem like depression might have a definition that says who we're talking about. But just outside those borders are people who are kind of similar. And we begin saying, well, they're basically depressed. And eventually we start implying that actually practically everyone has depression, even people who are bereaved or who are having very normal emotional reactions to difficult events or unsustainable ways of living. So, what is trauma? Historically, it really comes from physical medicine, and it refers to a physical injury or a wound caused by some outside event or force, like a bullet or an accident of some kind, or an injury sustained in war. It's not an internal disease like mumps or cancer or diabetes, but something caused from outside, usually suddenly. But people who've gone through these events show not only physical signs like broken bones or bleeding, but also psychological reactions. And we can get these reactions even without a physical injury. Now, they include a wide variety of symptoms, usually including prolonged or easily activated stress responses, a sense of reliving the traumatic event as if it's actually happening now, and a perceived need to avoid situations or stimuli that are similar to that original traumatic event. In the diagnostic criteria, Trauma is usually defined as exposure to actual or threatened death or serious injury or sexual violence as a victim or as a witness. And you can easily think of all kinds of experiences in accidents, crimes, or wartime that would fit. But almost all the boundaries in mental health are somewhat arbitrary. It's not like COVID, where you either have it or you don't. So if you're in a car accident that kills other people in the vehicle with you and severely injures you, that would pretty clearly qualify as a traumatic event. But what if you see that same accident from across the street? What if from 2 blocks away? What if you drive past that accident 5 minutes later? What if you're in an accident that might have been bad, but no one was injured? It's pretty tempting to begin thinking other things probably qualify too. After all, that line between trauma and not trauma is entirely imaginary anyway. But once you've shifted that line, how do you know where it is? If it's traumatic to see that accident from 80 feet away, what about 90 feet? What about seeing the accident on video? And what about other events like living in a community where there's lots of crime? What about living through an epidemic like AIDS that kills some of your friends? What about being raised in a family that never really wanted you? Here's a post I recently received on LinkedIn. Childhood trauma, which is a real problem and does exist, also includes a parent denying your reality. How much? Not being seen or heard. Having a parent who lives their life through your accomplishments. Being told you shouldn't have certain emotions. Having a parent who's focused on appearances. I think you can begin to see the problem. If you look at these definitions of trauma and many others that I could show you, the pool of people who have never been traumatized gets smaller and smaller. By this definition, and by many others, I can easily call myself a trauma survivor. In fact, I have a hard time thinking of people I know well who wouldn't fit the definition of trauma. At some point, we include virtually everyone. Well, okay, but trauma is partly defined by what you go through and partly by how you react. Are you showing signs of what we call post-traumatic stress disorder? If we go by the strict criteria, probably not. Most of us do not have fully diagnosable PTSD. But the standard thing that happens with border creep is that people begin disregarding those criteria and begin including symptoms that are less intense and, frankly, more vague. During the satanic ritual abuse mass delusion, symptoms like being stressed and dissatisfied with life or having unexplained sleeping problems were taken as signs that people had been victimized by satanic cults and must have forgotten all about it. Let's consider the diagnostic criteria for a relatively new diagnosis called complex PTSD, which actually isn't included in the DSM, the Diagnostic and Statistical Manual, the classification system most used in North America. But it does appear in the 11th edition of the International Classification of Disease, or the ICD-11. Here the idea is that the person has experienced prolonged or repeated trauma, but the definition of trauma isn't clearly specified. It includes the existing symptoms associated with PTSD plus 3 more sets. These involve difficulty regulating emotions, interpersonal problems, and a negative self-concept. And at this point, I think you can see the problem. These are extremely vague ideas. They're real. People do vary in how well they handle their emotions, and they vary in how easily they get along with others, and how well they think of themselves. But really, where is the line here? If we ignore the need for a person to meet those initial PTSD criteria, which are themselves a bit vague, almost anyone could be thought to have at least some of the symptoms of complex PTSD. Now, I want to be careful here. I am not saying that PTSD does not exist. It does. I've treated it. And many people have not had those near-death experiences, but have had ongoing, profoundly difficult life experiences in childhood or later. People have been neglected, emotionally abused, physically abused, discriminated against, routinely insulted for being a member of a minority group, being black, being gay, being indigenous, and just ask any woman if they've ever had any ongoing problems in the way they're treated by men. These problems are real. But by broadening the boundaries of trauma, we may have dissolved the boundaries altogether. At this point, what do we consider a trauma and what do we not? We're in a situation now where we have an enormous box before us, and waking up in a wrecked car with your best friend dead beside you is in the same box as being neglected in your childhood or having a mother who's very worried about appearances. I think that by putting virtually everything into that box, we've made the definition of trauma virtually meaningless. Today, if I say that I have a trauma history, this tells you absolutely nothing, because I might mean anything. And if a word might mean anything, maybe it no longer has any meaning at all. It's no longer useful. But there might be a hidden aspect to it that's actually harmful. By calling it trauma, we're setting it apart from the rest of life. It's something strange or separate, something that shouldn't have happened and didn't for most people. I do not mean to minimize by saying this, but life is inherently difficult, and our experiences vary along that scale of difficulty. Some of our experiences are easy to handle, including some that we might think would have been hard for us. Other experiences are profoundly difficult, and there is no clear dividing line between them. By the time you reach adulthood, and certainly by this age, you will have experienced a lot of very challenging things. Are they separate from the others? Not really. They're a part of our life. The boring bits and the challenging parts. The parts that we would never have chosen. And we're going to have some ongoing reactions to some of the things that happen to us. Again, I am not minimizing. Many of those challenging experiences are things that we can work on and help work through in therapy. But simply labeling those experiences, oh, that's trauma, and this isn't, is a fairly meaningless exercise. It's all your life. And for this reason, in my clinical practice, I find myself using the word trauma less and less these days. Like every label, it is a kind of box. But what's inside that box varies enormously depending on who's using the word. The only reason to use words is to communicate understanding. But when we're talking about different things, a word may only communicate misunderstanding instead. So I don't actually talk much about trauma. I talk about difficult experiences, not as a way of denying them or dismissing them, but as a way of moving forward with them. Not everything is a trauma. And that doesn't mean it's simple or straightforward or that it can't have profound meaning for us. Many of the most impactful events of my life and those of my clients are clearly not traumas, but they may have hurt or affected us, and we may need to process them in some way. Giving them a label is not processing, it's filing. And often, it's misfiling. There are other videos on this channel on the psychology of everyday life. Click the subscribe button for more. I also have an online course site, psychologysalon.teachable.com, with programs for professionals and for the general public. And my book, How to Be Miserable, 40 Strategies You Already Use, is available from online booksellers. Thanks for watching.